All, myself Adil Muhammedh, studying in Andijan State Medical University. So the topic we are going to discuss today is about hemothorax. Hemothorax, which is also known as hemorrhagic pleural effusion, is a condition when blood clots between your chest wall and your lungs. The area where the blood can pool is known as the pleural cavity. So the buildup of volume of blood in this space can eventually cause your lungs to collapse as the blood pushes outside the lungs. The pooling of blood in your chest can have numerous causes. Its most common are after the chest injuries or surgeries that include opening your chest wall, especially heart or lung surgeries. Certain conditions that cause your blood not to clot properly can also cause hemothorax. Hemothorax can also be caused by many of the same things that can be caused of pneumothorax. So let's move on to the symptoms that causes hemothorax. So what are the symptoms that causing hemothorax? The symptoms are pain or feeling heaviness in your chest, feeling anxious or nervous, next is dyspnea, then breathing quickly, then abnormal fast heartbeat, which is also known as tachycardia, then breaking out in cold sweats, then skin turning pale, and heavy fever, which is over 38 degrees Celsius. If your heart is racing and you are having trouble breathing, go to an emergency room right away to be checked of hemothorax or other conditions that may be causing these symptoms. Now, what causes hemothorax? The most common cause of hemothorax is a major injury to your chest. This is known as a blunt force trauma injury. This can happen when your chest experiences a sudden and intense impact. Examples include failing hard onto the front of your body or getting in a car accident and part of the vehicle like the steering wheel or a deployed airbag. Next, these injuries can damage your chest wall, your lungs, and major blood vessels around your chest. This allows blood to leak into your chest cavity and put pressure on your lungs. Getting cut or stabbed in the chest can also cause blood to leak into the chest cavity and cause hemothorax. Hemothorax also commonly happens as a complication of a major heart or lung surgery that requires a surgeon to open the chest wall. Blood can leak into the chest cavity if the blood doesn't clot properly after the surgeon closes the incision, or if an organ or vessel is cut open and the blood leaks. Other possible causes of hemothorax include blood not clotting properly and leaking into the chest cavity, cancer in the lungs, fluid and cancer around the lungs called malignant pleural effusion, cancerous tumors in your chest wall, large vein torn open with a catheter is inserted while you are in hospital, tissue around your lungs dying, which is also called as pulmonary infarction. In rare cases, especially outside the United States and other developed countries, hemothorax can be caused by tuberculosis. Now, moving on to the treatment. If you go to the emergency room for hemothorax, your doctor or emergency medical staff will use emergency tools such as ventilator with a tube inserted to your nose into your windpipe to support your breathing and make you sure you are getting enough oxygen. The most important treatment for hemothorax is draining the blood out of your chest cavity. Your doctor will likely put a tube through your chest muscles and tissues through your ribs and into your chest cavity to drain any pooled blood, fluid or air. This is called as thoracentesis or thoraxectomy. This tube may remain in your chest for several days if your lungs has collapsed so that it can expand again. If the bleeding continues even as the tube drains the blood, you may need chest surgery to treat the cause of bleeding. Chest surgery is also known as thoraxectomy. Now, let's move on to how hemothorax is diagnosed. Doctors may take several types of imaging tests of your chest and lungs to see what is the causing of bleeding, especially if you have a major chest injury. CT scan can show the doctors the structure of your chest and lungs so that they can see any abnormalities. Your doctor may also take X-rays if you have broken any bones or been injured anywhere else around your chest. Now, is there any possible complications for hemothorax? Losing a lot of blood from the condition can cause your body to go into the shock because of the lack of blood and oxygen being pumped throughout your body to your organs. Shock caused by blood loss is known as hypovolemic shock. Going into hypovolemic shock can cause long-term or permanent damage to your organs, including your heart, lungs, and brain. Blood getting into your chest cavity can infect fluid in the area around your lungs. This type of infection is known as emphysema. An untreated emphysema infection can lead to sepsis, which happens when inflammation occurs through your body. Sepsis can be fatal if not treated quickly. A collapsed lungs, if untreated, can cause you stop breathing. This is known as respiratory failure. It can be fatal unless you are able to get emergency medical help. Now, what is the outlook of hemothorax? See your doctor as soon as possible after a serious chest injury, and if you have any trouble breathing for longer than a minute, call your doctor if you develop any symptoms listed above. Hemothorax is a serious condition. However, hemothorax won't cause any long-term damage if it is diagnosed and treated early. So this is the review of hemothorax. Hope that topic was very informative.